national development to be in place. Without infrastructure, without that road, there wouldn't have been those houses. There wouldn't have been any possibility of industrialization and things like that. And that is one of the key things, not just from the road to coastal road to Burfoot and Katong, but also I understand, although I haven't been since I left Armitage High School to the provinces in 1986, I understand all those roads have been paved as well, and what more could one have asked for? None of those roads. We had to travel on gravel, on paved roads, and it took ages to arrive between Burfoot and Serakunda. And at the time, as a student at St. Teresa's Primary School, and then of course St. Teresa's Secondary, we've had to walk on foot several times to get home. That is history.
This is the interview on GRTS. My guest is Dr. Buri Jatta. He's got a BSc and PhD in tropical diseases, of course, MSc in humanitarian program management from the Liverpool School of Tropical Medicine in partnership with the Institut Bioforce Développement Lyon in France. When you came, I'm sure you have visited the RVTH. Your impressions?
For me, one of the most impressive, aside from the Royal Victoria Teaching Hospital, now that it is, when I left the Gambia, it was Royal Victoria Hospital. It wasn't a teaching hospital. One of the key achievements in terms of health in the Gambia is the establishment of a medical school. At the beginning, that had received a lot of doubts and questions and worries about the competencies of the students or potential medical practitioners who were to leave the institution. I think that again had been refuted as a non-topic. We needed a medical school. Now we have one. We can train our own people without having to leave the Gambia. There are a lot of people who have left the country who would have been doctors if the medical school was there in those years. It wasn't. Now that in itself is beyond any kind of imagination at the time that Gambia would have its own medical school training fully qualified doctors who can work here and contribute in not just national development in health, but international. That in itself is a major achievement. Regardless of whatever claims and counterclaims there may be, the Gambia had over the last years made significant progress, and we need to recognize those and be able to praise the achievements that have been done wherever we may be. And I think for me that is in fact one of the main success stories of the health sector over the past few years.
I'm sure the students in the health school will definitely like to have a listen to you. Probably you might be a peer role model to them for having, excelled in your field. Now let me take you to Ndey Jawara. She was a patient. I don't know what her ailment was, but you were one of those people who spearheaded and galvanized support for her to be taken out of the Gambia for treatment. Tell us about that story.
The story was in the, of course I came on a holiday around 2000, the year 2000, to visit my family. As I said, although I left the Gambia physically, I was always in spirit, I was always in Gambia. So I came on a visit, and a family in Burfoot that I knew when I was little. I knew this old gentleman and his wife came to me with some documentation. At the time when I arrive, whenever I come home, crowds of people will come to seek help and advice in various forms. And then they presented me a number of documents, and I went through them. And reading those documents from Royal Victoria Hospital, from the MRC, Medical Research Council, I realized that what this girl had was defected heart valves, and that she needed a valve transplant, a procedure which was not available to her in the Gambia. She was about 16 years old. She was as skinny as a stick, and was told to go home and die peacefully because there's nothing more they can do for this poor girl. The family came to me and were crying. The dad was in tears and said, well, you are the last hope that we've got. Our daughter is dying. We are poor. We don't have the means to save her life. And the only reason she is dying is because we haven't got the money. If we did, we would have paid every single penny that we've got to save her life. We don't. Please help. It wasn't an easy decision because I knew this little girl before I left the Gambia. She was very little, about 10 years old at that time when I left. And now looking at her and knowing that this is a procedure which is available and that her life could be saved if only I could do something, you know. Bad things happen when good people do nothing. So I said to myself, well, I need to do something about this poor girl. When I arrived back in the UK, I wrote to one of the consultant cardiothoracic surgeons at the Oxford Hospital, General Hospital, John Radcliffe it is called. The consultant replied back that I would help this girl, because I wrote a really comprehensive, detailed report about her medical case and the tragic poor conditions and the poverty that engulfs her family. Of course, he wrote back to say, okay, now this operation would have costed maybe £40,000, but I will do it at no cost. What you now need to do is to bring, of course, pay the expenses of the National Health Service, and then we will do the procedure. And that, again, wasn't cheap, because he was going to be treated as a private patient at a cost of about £12,000. My colleagues, doctors, nurses, health visitors, hygiene promoters, you name it, we came together. We started fundraising through my leadership. We were able to raise the funds. And I came back, took the girl from the Gambia to the UK. It was on the media in the UK, televised. She had an operation and discharged. She was brought back to the Gambia by myself. And the event was televised by Gambian television services at the time. And I received a lot of congratulations for my effort in saving this young girl's life. She's now happy and healthy, and about about a year ago, she got married.
Oh.
And she's a happy little girl now, a woman. Yeah, and the difference, of course, when she was going to the UK, on the footage, I think on your archives, I'm sure, when she was going to the UK, she could hardly walk. She was stick thin. And when she was coming back a few months later, she was a healthy, it was like she blossomed like a flower, beautiful, healthy, young woman returning from the grave to the Gambia. It was amazing.
It was.
It was in about 2001 that she came back.
When you look back at that, how do you feel?
I think, like I said, bad things happen when good people do nothing. What we as Gambians are known for is trying our best. And I think for me, it fills me with the satisfaction of knowing that that girl would have been dead and buried had it been that we did nothing, you know. And that for everybody, this is a lesson that all we have to do is our best. And if our best is not good enough, we can look back and say, at least I did my best, you know. So that is from my perspective, that is the way I look at things.
Dr. Bori Jatta, let me take you now to Afghanistan, where you are presently in very volatile situation, and you're working there.